Oh my gosh, you sent that Tuesday. My fault.
You're good.
Old people.
Mr. Domingo,
Yes,
I just wanted to let you know I will not be in class on Monday. I'm doing the physical at
at
Meds.
MEPS. Okay,
Yeah, because I passed like the ASVAB and everything.
good.
So,
Did you do well on your ASVAB test?
no, but I'm in.
It's it's okay. It was enough to get in the army, right?
Yeah,
Don't
I
worry
did
about
good
it.
on the personality test.
Well, that's good. You have to be a people person if you're working with patients, you know what I mean?
Yeah,
Or somewhat of a people person at least.
yeah,
Just get ready to get yelled at when you roll up on the bus to boot
yep,
camp.
yep.
It's such a fun experience.
Yeah, they were telling me that nothing can prepare you for that.
Oh, like, why are we in uniform rolling around in the mud with boots on back and forth? I don't know.
I'll email you a picture of like the note saying that I'm excused.
Please do. Thank you.
Okay.
All right. We have Reedy and Blair on, right? Just making sure.
Yes.
How's it going? Would you mind completing that questionnaire for the CPR and the scrub thing? Unless you've already done it.
On, is it in Google Classroom?
It is.
Okay,
I
yeah.
hope I assigned it to you.
I probably just missed it.
Don't worry about it. It's like me missing emails and GroupMe, so.
Yeah.
But I have an excuse. I'm old. Reedy, I think I got a message from you, right? I'm still at school for a meeting, so my camera's off. All right. But I will be home. No problem. Do you see it now, Blair? All right, thank you. They're freaking out on me because they're like, your students haven't done it yet. Gosh, it's not until November. All right. You all should have gotten a class work, class notes thing pop up at 1 o'clock. Um, that's going to be done a little bit differently. I'm going to try to redo it to where it's more productive and thought provoking. Um, It involves a little bit more critical thinking skills on your part. So just be ready for that. Also, I apologize for the bombardment of homework assignments, but they should all be reviews for you just to comb through. I think the worst I got in there is what, one for 20 questions, but everything else should be about 15 if I'm not mistaken. All right. Did everyone see the study guide? Everyone happy with that? Okay. If you know that, you can at least memorize that stuff. Um, I'm sure reading through it's gonna bring some, I don't know, generate some thought-provoking uh memories that we talked about earlier in the course. Hi, Liana. So use that primarily as a guide and reference your notes and presentations if needed. And we should be good.
I have a question.
Yes.
Okay, so I was gone on Monday because I was in New
Mhm.
York. So what do I do about those like assignments? Like what should I like can they be done like without getting points taken off since I was gone?
Vivian, let's see. Homework chapter 6, questions of the day. Yeah, just get them turned in.
Okay. Okay,
Yeah,
thank you.
please. No problem. All right, I
Mr.
cannot
Daniel,
emphasize the importance of that study guide, folks, okay? What's up with that, Aubrey?
what are we doing for midterm if that's our fall break?
When do you start again?
I go on fall break on Monday.
Then we'll have you do it when you get back, I think. Because
Okay.
Friday's your last day, right? Obviously.
Yes.
And Aubrey, what school are you at again?
Options.
Options. Anybody else?
Mr. Domingo, I have a question. On October 9th, we have like a different schedule for like the PSAT. So we won't be here like for half of the day. And then we have classes like all over the place, like in the middle of the day. So what do you want me to do about that?
That's your SAT, right? You said?
Like the PSAT, like
Oh yeah.
it's for the school,
Preparatory.
like the juniors are doing
Yeah.
it. Wait, is it the sophomores? I don't know. But now because of that, they got our classes, like our regular daily classes scattered out. So like when I'm supposed to be in here, I have like three other classes that I have to be in.
And you're TPI Noblesville.
Yeah.
Seconds. You can either have your mom or your counselor email me and let me know. That way I can put in your student folder, okay? And excuse
Okay.
you. Yeah, totally doable. Thank you. Anything else out there? Concerns?
I had a question about the study guide.
Yeah.
Are those just like statements that you want us to know? Because it's not like necessarily a question, it's just like a statement.
Yeah.
Okay. All right. Thank you.
If you guys are good at memorizing stuff, you should be okay for the test. It's very close to what we covered in the presentations. A lot of those are the highlights that I put in from the very beginning, okay? So just do your best. I believe in you. If I can do it, y'all can do it. Okay, while we're waiting, I'm still doing attendance right now, so give me a second. And make sure you're looking up what CLIA means. Okay, you guys can remember CLIA. I know it's in the notes. I know it's in the presentation, but write it down again so you can know off the back of your, out of the back of your head, off the tip of your tongue, excuse me, what that means. Sorry, Mr. Domingo's slow. Be patient. No yelling at me. Okay. All right, folks, I'm almost done. Sorry. All right, what does CLIA mean? Anybody? Don't be shy.
Clinical Laboratory Improvement Amendment.
Very good. Thank you. All right, so Hannah was brave enough to come out with that. So what are some tests that qualify under CLIA that are waived? It's not
Pregnancy
necessarily
tests.
Hannah. Sorry, go ahead.
I was going to say urine pregnancy tests.
Very good. And don't forget anything that a specialty doctor, say you're at the lung clinic, for example, you need to give breathing spirometry tests, things of that nature. Those specialty tests are allowed. Also, not a testable item, but other exceptions or waived tests would be like drug tests, for example, forensic tests for criminal investigations, things of that nature. Or if you end up working at the ER, someone comes in for lack of better terms, an assault, and they have to get a kit out because someone took advantage of them. That is a CLIA waived kit as well. Okay. So, let me share my screen. Okay. As we just mentioned, CLIA waive testing is mandated by the FDA, and they also exempt certain tests, like Liz mentioned, like Hannah was about to say too. Good job on that. That was where we left off last week. So CLIA, again, you should have this in your notes already. If not, I'll leave it on here. Established in 1988 to ensure the quality of diagnostic testing through lab regulations. So these wave tests are the lowest levels of complexity. We don't have to send it out for a 3-day culture test, for example. It's something we can instantly get. All right, a drug test, a glucose test from the finger sticks, for example. And again, moderate and high complexity tests, things that have to be sent out or take a number of days, like cultures to test and complete, those are non-waived. You know, you're here, right? I didn't even mark you. I thought Maribel. Is Maribel Guzman on? No. And Alexandra, you were talking to me. I didn't even mark you present. My fault.
It's okay.
I'm horrible. Okay, quality controls. QA assurance encompasses policies and procedures that ensure the reliability of tests. So if you're asked what ensures the reliability of tests, QA, quality assurance.
Mr. Domingo,
Yes.
my attendance is marked as missing.
Mackenzie. Hold on.
Yeah.
I think everyone is for today. I'll mark you guys as being here. Don't worry about it. Yeah, I'll get to it.
Okay, thank you.
Thank you. We had Miss Friedman just join us, our company. She is the coordinator for CCMA and POH, my principles of healthcare class. Ms. Friedman, these are our exceptional students.
Hello,
Very
everyone.
intelligent, more intelligent than Mr. Domingo. Their comprehension of this information is amazing. So, Ms. Friedman will be on for every class, taking care of attendance. I did complete those and highlighted those who were here in green already, okay?
Sounds good.
Excellent. Okay, so quality control, for example, checking the expiration date, just like the 5 rights of medications. Always double check yourself. Okay, check the expiration date. Recording the temperatures on refrigerators, always double check yourself. And if you're in doubt, don't make any guesses. Don't lie. Don't cheat. Don't do any of that. Always seek help, okay? Everything is subject to scrutiny in a court of law, like we mentioned before, okay? And that ranges anywhere from HIPAA violations, like if someone happens to report that one of your friends is at the clinic and you text somebody else, that shouldn't be happening. You shouldn't be talking about patients' private or a PHI, their health issues, okay? So we'll get to that here in a second. And there it is, HIPAA. What is it? It's the Health Insurance Portability and Accountability Act. All right, these are national standards for the protection of sensitive patient data. You will need to know that. And I think I put that on your study guide, hopefully. Yeah.
I have a
Okay.
question about HIPAA.
Yeah.
So, like, for example, let's just say, like, this is theoretical, but if someone were to tell me, like, oh, like, I have this disease, and then I were to go and tell somebody else, is that a violation of HIPAA? Or, like, if I were to tell someone that I have a disease, and then they tell somebody else?
That's a good question. Yeah, if they tell you, then that's exactly where the information should stop, especially if you're a nurse or a medical assistant.
Okay, but, like, just, like, if it was, like, a friend and I'm not a nurse, then is it still a violation?
I would say yes.
Okay.
Yeah, I would even chance it because they can come back and say, I
Sue you.
entrusted this person with this information. Now I'm going to sue them for letting this information out. Okay.
Okay, that makes sense.
Yeah, even
Yeah.
if you are off the job, if you have a certification of any kind and you're bound to HIPAA, you can't be sharing personal information of any kind outside of that known confidential agreement.
Yeah.
Okay, yeah, I was just wondering because I feel like that stuff, especially in high school, like if you tell one person, it just kind of gets like spread a lot. And I was just kind of curious to if that was against HIPAA in any way.
Yeah, it could be subject to it. Yeah.
Thank
Yeah,
you.
good question. Like so and so has mono. Oh, did you know so and so has mono?
That happened at my school. I think like
It
20
happens all
kids
the
got
time, I
mono
bet.
and it went around like crazy. And everyone was talking about it.
Oh no. Yeah, unfortunate. That was a good question though. Thank you. All right, we should always be cognizant of any data breaches. All right, so what is that? Incidents where unauthorized parties gain access to PHI, to protected health information. Health clearinghouses, what are they? They are mediums to standardize and process health information. Sounds kind of funny. What is a clearinghouse? They're essentially mediums. Clearinghouses exist on the financial side too. So for example, like if you're doing a ACH transaction as automated clearinghouse, ACH out of your bank accounts, out of your debit cards, for example. In this case, it's a health clearinghouse. All right. Both mediums that regulate what information goes in and out. Questions? Okay, pretty straightforward, right? All right. PHI is protected under HIPAA. And what do you need to know about that? Notice of privacy practices. So each clinic, this will be part of your orientation when you go to your clinical rotations for seniors, for example. Juniors, you'll see this next year. They're required to develop and distribute NPPs, Notice of Privacy Practices, that explains patient rights. All right. What does that mean? We safeguard your information, patient's information. We don't put it out there. We don't let anyone know why you're here. And that includes family members, unless you're a parent or guardian. The only exceptions. What else do we need to know about PHI? If you're logged into a computer doing your rotations, or if you're shadowing, they happen to allow you to jump on the computer, which may not occur, but if you find that you have to walk to another workstation, you cannot leave the computer logged in. You must log out every time and do not share your password. All right, so that brings me down to ePHI. What are some electronic PHI guidelines? Not sharing passwords, use of multi-factor verifications, and changing or updating your passwords on a regular basis. That is a testable item on the CCNA exam. Other acronyms you'll see on there on the NHA CCNA exam, PHI and NPP. For you prospective nursing students, you're going to see this stuff all over again. Questions about HIPAA? Zane, stop yawning, man. It's contagious. All right, just making sure no one else is writing. Liana, you good? Are you caught up? Don't feel rushed. Ask me questions. Tell me to slow down. You can ask me what time it is in Colorado right now. The weather's good. It is not humid, thank God. Is the sunshine at least out in Indiana again?
Yeah, the high's like 69 today.
Oh, nice. It's cold as heck in the morning, huh?
What? How far behind is Colorado in time?
2 hours. Yeah, it's only 11:27 here.
Dang.
I know. So I got to get up and teach that POH class at 6:15 my time in the morning. Fun.
That sounds awful.
It is. I should complain, right? All right. Specimen collection techniques and requirements. Welcome, Reedy. Welcome back, at least. Reedy, can you hear?
Yeah, I can hear you. I just got home. I just switched on to
Okay.
my computer.
Sweet. I already got you as present anyway, since you were on at school. Can you complete that CPR thing, please?
Yeah, I'm in the middle of completing that. I just want I need to use my personal email or like a school email for that.
Ms. Friedman?
I believe you can use your personal email.
Okay, thank you. Because I know like we're operating off of our school emails right now, so I just didn't want to confuse anything with it.
Okay.
Thank you.
Yeah.
Thanks for clarifying. Okay, what should we remember when collecting specimens? Collect at the appropriate time. Collect from the collect a specimen from the site of the suspected infection, if applicable. All right. Minimize transport time to a reference lab. Should it be at room temperature? Should it be cold? Should we let it sit and let the culture grow a little bit before we send it off? Did we collect enough urine? Did we collect enough blood for the blood tubes? Did we use the appropriate containers and label them accordingly? All right, so what does it mean to collect a specimen at the appropriate time? Often you'll have tests where they conduct cholesterol tests in the morning, glucose tests. For you nursing students, blood gas tests where they draw blood gases of oxygen levels out of the artery from the radial artery of the wrist. All right. A lot of those will be done in the morning time just to see what the baseline is. Collecting the specimen from the site of suspected infection. So if it is a culture, then they'll collect it from the site of the wound, for example. But if it's a specimen for, say, a chem panel, like we talked about the other day, to acquire cholesterol levels, obviously you're going to draw it out of the right or left antecubital, the inner elbow. Okay. Transporting time to a lab should always be as quick as possible. We need fresh specimens to get there on time and at the proper temperature. All right. So when we go through our labs, we'll talk about spinning down the actual tubes themselves, what they require, what you'll see, and what's separated from the blood itself. For example, the plasma from the RBCs or red blood cells. Okay. Collecting the appropriate quantity. Let me give you an example there. This applies to, say, urine collection. Urine has to be collected at least a third of the bottle, those little things that they give you for urinalysis tests. All right. Same goes for blood tubes. You need at least half of that filled up. And there will actually be a line on those blood tubes on the actual ones that you're going to be using that'll tell you where to fill it up to. And obviously using the appropriate containers, labeling them accordingly. So if we want to run a chem panel, say a cholesterol test on a red tube, but we run it on a purple tube, that is not going to work because the purple tube has the anticoagulant in it. Okay. So appropriate containers and appropriate labeling like we talked about yesterday. And I think on the study guide, we should have a minimum of what should be on that label, correct? Let's see.
Mr. Mingo, I want to ask something really quickly.
Please.
What if we already have like our CPR certification?
You asked me that before, didn't you? Or was it one of the CNAs?
I'm not sure, but I know I got certified like last year. So do I still
Yeah.
have to go through with the online training or no?
Yeah, I would recommend it. I think it's necessary for you anyways, and it just starts over your 2 years anyway, so it can't
Oh,
hurt.
okay. Okay,
This
thank
one
you.
is through the American Red Cross, though. I don't know if you're American Heart Association.
Yeah, I have the AHA card.
Okay. Yeah, let's get back to the labeling later on.
Okay, thank you.
No problem. So at least now you have both reading. You're good.
Mr. Domingo,
Yes.
did you did you find out where that was going to take place?
I didn't yet. No. Miss Friedman, remind me later. We need to find out exactly where and when each day that our November rotation, in-person rotation, is going to take place. They haven't come out with the actual schedule yet, Joanna.
I will absolutely get that information. Also, keep in mind if you're filling out that CPR training form, it is also giving us the sizes for your scrubs for rotations. So please fill it out, even if you have your CPR certification already.
Thank you. All right. So, what are our responsibilities as medical assistants? Nurses, anyone that are collecting specimens, match a correct lab requisition to the order prior to transport to the lab. So just like we're doing the 5 rights on the medications, we're doing essentially the same thing for these specimens before they get sent out. Okay, sending the specimen containers that do not coincide with the patient's lab request contributes to delayed diagnosis and retests. So the last thing you want to do is have to draw blood on these patients and then go back and say, I mislabeled it, or this is someone else's blood. I have to stick you again. That is not going to be a happy person. One of the top reasons for rejections at the lab are incorrect labeling, incorrect orders, incorrect requisitions. All right. What
Could
is
you
the
go
most
back for like a
commonly
minute?
tested? Yeah.
Like really like 10 seconds.
No, you're good. Sorry about that. Don't write down too much to where it's going to confuse you, okay? I don't want you to get lost in your notes.
I'm good, thank you.
All right, no problem. All right. What is the most commonly collected specimen in an ambulatory clinic, an outpatient clinic, an urgent care clinic, same day clinics? It is urine. Random urine collections can be collected at any time of the day. And as you've seen in the past, if you've been to the doctor and had to provide a urine specimen, it's in a clean, non-sterile container. You'll see them with the little seal that's on there, on the side of it. As soon as you turn it, it cracks the seal. What are some exceptions to any time of the day collections? All right. This is where the first morning specimen is required. Why? Because the patient tends to be a little bit more dehydrated in the morning after waking up, right? This helps to figure out HCGs. Everyone remember what HCG means from your notes?
Human chorionic gonadotropin? Something like
Very
that?
good. Yep. Who was that?
Mackenzie.
Good job, Mackenzie. Human chorionic gonadotropin. HCG. And that is a test done on all females when they go to the clinic. And as a reminder, why? Because they don't want to give you any medications that will be contraindicated in case you are pregnant. All right, so it's done almost every time you go to the doctor, especially when you're sick. All right, so used for HCGs and checking other analytes like proteins and nitrites. While you're finishing your notes there, you might have noticed I haven't given you a project because I bombarded everyone with homework assignments. So you will not see a project this week nor next week in preparation for the midterm.
Hey Hannah, you have your mic on and I could hear your background noise, and every time Mr. Domingo talks, it like bounces back and forth.
Sorry about that.
I'm sorry. I tried sending you a direct chat, but I was like, oh, she's not even looking at it. I'm sorry. Thank you.
All right, any questions about non-blood specimens? I'll hang out on that slide for a little bit. So you nursing students going to ball next year, you're gonna delve a lot deeper into this stuff. Be talking about specific gravity of urine, things of that nature. It is horrible. Don't let that discourage you. Our guest speaker said thank you for being patient, and she hopes she didn't turn anybody off from nursing school. And I told her about what Julia said. Julie, remember that? You drop already? Come on. All right,
Did you
any
say my
questions
name?
about this? What's that?
Did you say my name?
Julia?
Yeah.
Yeah, I told Miss Michelle about what you said, your apprehension about nursing school after hearing that it was like high school. She's like, oh God, man.
Oh, yeah. She was telling me it was like high school, and I was like, I don't know anymore. I'm still thinking about it because now on my For You page, like on TikTok, it's a bunch of videos about like radiology and like all like the behind the scenes stuff.
Every environment is like that, like I told you. So you're going to encounter it anywhere you go.
Yeah.
But if you want to be able to expand and go anywhere you want and do anything you want, stick with nursing or even getting your doctorate eventually.
Yeah. I think
I'm a
I'll probably just stick with nursing.
I'm a
that?
CNA at a nursing home with grown adults, and it still is like high school. It's the exact same.
Is that Sarah?
Yeah.
Sarah, the military is going to be worse. So get ready.
Yeah. Grown adults acting like children it's a thing.
Yeah.
It's everywhere. I'm a waitress at a restaurant in my town, and it's the exact same thing. I fight with a 40-year-old all the time, and I'm 17.
Oh my gosh. That's
That's how
ridiculous.
my old job was when I worked at a restaurant. There's always drama, like in the food service industry.
Yeah.
I switched recently from like food to like retail, and it did not get any better. Like I had like a 60-year-old woman yelling at me because apparently I didn't accept her coupon, even though like
It was
it was
expired.
expired. Yeah, it was like I work at Kohl's and she was complaining about like Kohl's cash, and I was like, I've only been here for like 3 days. I don't know what you're talking about.
Yeah, I switched from the like food industry to like I work at a crew car wash. It's only in Indiana, so you don't know what that is, but for me, like I found it was like a lot better. Maybe that's just because like all my coworkers are really, really nice, but it's definitely less drama.
Are there more dudes there?
To surprisingly, like my location, it's like mostly all girls. Like we had like an old lady come in once and she was like, "Is this an all girls crew location?" Cuz like yeah, it's like mostly girls, like where I work at least. I don't know about the other locations.
That's crazy.
Yeah.
I guess it just varies, you know what I mean? So she
I
did
love my
say
job. I don't
sorry,
know
and she
about you guys,
apologized for
but
saying the wrong thing. Sorry, Blair, go ahead.
I was like, I love my job. I feel like, I don't know, I've gotten lucky, I think.
Blair, where do
That's the
you
derm
work?
clinic.
I work at like a luxury retail store. It's in like Keystone. There's like a couple around the state, but
Oh,
yeah.
that's nice. I work
Everyone's
at
like older
Toys R
though,
Us.
so.
There you go. You're also doing rotations at that other derm place, right, Blair?
Yeah, that's my internship. They're nice there too, but it's only like four of them, so yeah.
Yeah. So it all varies. All right, we got off topic. Just wanted to say that Miss Michelle apologized if she turned anyone off from nursing during her little spiel. All right,
She made it
so
seem more
this,
intimidating.
what's that?
She just made it seem like more intimidating than I thought it would be.
Nah, no, you'll be good. All right. If you've ever had been ordered to provide a clean catch specimen midstream, this is a testable item. All right. So cleansing the genital area with 3 moist antiseptic wipes. So specifically females, they would give you 3 wipes. Okay. Wipe each side and then the middle. You urinate for a little bit and then you provide the specimen into the cup. Same goes for the male. Wiping each side of the glans and then the middle with separate wipes. Urinate into the toilet a little, pause, and then collect the remaining urine. And that is considered a non-contaminated sample needed for cultures. And this is you need it for UTIs, kidney infections, etc.
This is kind of a weird question,
Yeah.
but why do you start urinating and then stop and then start collecting?
The initial area at the urethra is considered dirty, even though you wipe it. So we're assuming that there's bacteria going further up into where you couldn't wipe. So we urinate a little bit, stop. Hopefully that's clean as possible, and then we get the remaining urine out of there.
Okay, that makes sense.
Yeah.
Thank you.
It's as strict as washing your hands for 20 to 40 seconds. It's even more so, you know what I mean? Because we need an aseptic type sample to test if we need to grow a culture, for example. Okay. Good question. All right. So when you're advising your patients how to do it, especially if it's a male, make sure you're letting the male know not to let any contact between the person and the cup occur. You kind of get my gist. Questions? We're all gonna be grossed out by germs by the time we get done with this whole course. You already know how many times we have to wash our hands before we do anything, right? Okay. Yes. What's up, Shimon?
Oh, nothing.
Okay. Gotcha. Okay, so you will also at times be required to ask the patient to provide a 24-hour sample, voiding up to the second day that morning when the urine sample is due. Okay, these are needed for quantitative analyses of such proteins in the kidneys. Kidney function tests, things of that nature. So when they're taking these tests for the period of 24 hours, they're essentially looking for creatinine levels, urea, nitrogen, things of that nature. Creatinine levels need to be at a normal range for your age, gender, muscle mass, BMI, composition, etc. See if anyone is still writing here. All right, moving on. That's okay. A catheterized collection, all right, used when a sterile urine sample is needed. Okay, this can be a long-term thing where they wear around for a little bit, as you can see. All right, that's a Foley catheter. That's one that is inserted into the urethra, into the bladder. These are done on, say, children, for example, if they're very sick and the child is super dehydrated, but the doctor needs to get a specific gravity on the urine. They will often, unfortunately, cath the child, collect the urine, and pull it back out. You turn a otherwise normally sick, unhappy kid into an angry kid. Not surprisingly. So what is your role as a medical assistant? Prepping the area, prepping the kit. It is a sterile kit. So when we see the two types of catheters, it's a Foley and there's also a Texas catheter. Foleys go inside the urethra. Texas catheters stay on the outside for males. And the Texas catheters go on the outside of the penis. Okay, FOBTs, fecal occult blood tests. We talked a little bit about collecting and what it shows, what we're looking for, anything where we're trying to detect any evidence of blood in the GI tract. So what are some preparations you need to do if you have a patient that's coming in for a preset appointment? Make sure you tell them over the phone, reminders in advance. For 3 days prior, you should avoid red meats, food with dyes, aspirin, any of the ASA products. Acetylsalicylic acid is aspirin, ASAs, vitamin C and iron supplements. We'll most likely see this again. Hint, hint. Questions about that? I apologize. I normally have videos up for you, but I want to get to the review with you all before I leave to go on PTO. All right, so the FOBT, you can see, expect to see on the test. Same with letting your patients know about the 3-day requirement for avoiding these specific consumption of these products. All right, if I go ahead a slide, who am I leaving behind?
Me, could you stay on it for like another minute or two?
No problem. You're good.
Thank you.
Let's see here. Put you on. I'm going to add this video for y'all to watch here. I'll just be rambling on the whole time. Okay, let's talk about the Hemoccult. Okay, this is Hemoccult is what I just said. Yes, sounds funny, but it's true. Let me make sure that I'm sharing my sound.
About poop. Yes, I said it, poop. We're going to look at the Hemoccult blood test that we're using to test for fecal occult blood. We're going to look at why we're doing it. What do our patients need to know? What do we need to know to collect the best sample to improve the accuracy of this testing? And we're going to do that all right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Alright, so one of the first things we need to know is what the fecal occult blood test is and is not. It is a screening tool. It is not diagnostic, and that's an important detail to remember. This is simply letting us know if there's blood in the stool that we cannot see with our eyes. That's why it's called occult. It's hidden. This blood might be coming from a peptic ulcer, GI inflammation, maybe they had a nosebleed and it's kind of made its way through. We can't see those pieces, and so this is simply just going to tell us, is there blood present in the stool or not? Now, if we're using the old Hemoccult 2 testing strips, there's some very specific information that our patients need to know and we need to gather to improve the accuracy. So let's take a look at the things that can cause false positives, false negatives, and what our patients need to know. A false positive result can occur if our patients consume red meat, are taking medications such as aspirin, NSAIDs, corticosteroids, anticoagulants, and chemotherapy, or consuming excess alcohol. When it comes to a false negative, we're looking for vitamin C. Did I mention vitamin C? Yes, I did. Vitamin C. We want to avoid an excess of 250 milligrams a day, so we're looking to see how much is in our supplements, if they're taking fruit juices, and iron supplements. So what does this all mean for our patient? Well, essentially, we have some timelines and some teaching that we need to do. 7 days before beginning the test and to continue during the collection of samples, we want our patients to avoid NSAIDs. Now, they can take acetaminophen, that's fine. 3 days before the test, and again during the sample collection, what we want for our patient to do is to avoid red meats and avoid excess vitamin C. In looking at our sample kit, we see that we have 3 applicator sticks inside and 1 slide test card. When we open this up, you'll see that the test card is actually a series of 3 testing kits. I've gone ahead and already labeled the information that you'll put on your patient's card. You may be using a patient ID sticker, or if they go home, they'll need to label this with the relevant information. There's also 3 sample collecting sticks inside. We're just going to keep one out for now, and I'm going to show you next how to collect the sample. So I'm going to open up my first testing strip, and you notice that there are 2 areas labeled A and B. This is where we're going to put our stool sample. Collecting a stool sample will require a dry, clean container, and you want to catch the stool before it contacts the toilet water. To demonstrate the stool collection, I've got some peanut butter here in a clean, dry container. Taking the end of your applicator tip, you will select a small amount of stool from one side of the stool sample, and you will put a thin smear in column number A. Of course, you should be wearing gloves, and I forgot to put them on for demonstration, so please make sure you have your gloves on. We need to then take a second sample from another area of the stool. So I'm going to go to the top end here, and we're going to then smear this into column B. Collecting samples from 2 different areas will increase the likelihood that we can identify if occult blood is present. Once the sample is collected, we're simply going to close this, secure it under the tab, and we want to leave this sit for 24 hours to air dry. Completing the set of stool samples will require that we collect samples on 3 different days. Now, there are some important considerations for this as well. If blood is visible in urine or stool, such as when you have menstruation or you have hemorrhoids, do not collect a sample on that day. We also need to return the completed set within 10 days after collecting the first sample. That is our lesson on poop. Until I see you next time, make it a great day, and be sure to subscribe to these videos that you're seeing popping up here so that you can stay connected and be notified when the next video is released.
All right. Questions about the video? Okay, let's say you're at a gastrointestinal clinic, a GI clinic, in urgent care or even a an emergency room, you will often be asked to grab the Hemoccult test. That is what it is. That is what it means. Don't be confused when you see that. 1 second here. Let's go through it.
All right, so one of the first things we need to know is red meat.
All right, just like on our slides, we talked about avoiding red meats, medications for 3 days prior. Anything here has large amounts of heme or blood in it, right? Or plasma. These medications, aspirin, NSAIDs, corticosteroids, all of these things can cause gastric upset and cause your stomach to bleed a little bit. All right. What are NSAIDs? Anyone know? Okay, if not, it's all right. So aspirin is very hard on the stomach. So are NSAIDs, non-steroidal anti-inflammatory drugs. That includes naproxen, naproxen, Motrin, Soma, things of that nature. Those are NSAIDs. They're not quite, I should say, Schedule 2 type drugs or Schedule 3, but they're definitely not weak aspirin or Tylenol type medications. Just a little bit stronger. They're anti-inflammatories used for musculoskeletal injuries, for example, to bring down the swelling. Questions about that? All right, we need those to avoid those things, to avoid false negatives and false positives. 3 days. So there's nothing wrong with going 7 days if the doctor requires it, but at a minimum 3 days, all of these should be avoided. And that is per your NHA CCMA exam. Okay, so what comes in a kit? She showed you already the Hemoccult 2 test slide, 3 sticks, and patient instructions. So you're going to advise the patient to do this. All right. A lot of times they're going to have you do it, assist the patient once the patient brings the sample out from the bathroom. Fun. All right, so first, what do we do before we open it up? Always verify the expiration date. Don't just open it up and assume that it's good to go. These tests do expire. I just said do. Sorry. Didn't mean that. All right, so what do we do? Correct labeling is required because it's going to sit for 24 hours. Once you get the sample, you're going to have 2 testing areas, A and B. Okay, you just have to swipe both. One is a control. Control is like the baseline. All right, it essentially says, hey, this kit is good to go. It's working. This is the baseline we set. The second swipe is essentially, this is the actual value we should be paying attention to. So don't forget to apply the appropriate amount. And what you'll do is advise the patients, use a clean container, which you'll provide. It looks like a little white hat, but it goes upside down into the toilet for the patient to void in. To defecate. Obviously, don't let it touch anything in the toilet. That includes the water. Sometimes it'll look like this. some clinics still use this, but it's like a half hat that goes in. The front part allows them to urinate, the back part catches the stool, and this is where you'll collect that sample from. And she talked about stool collection, using the sticks to swipe. Any questions about that? And we will not be required as medical assistants to interpret the results, nor deliver results to the patients. That will never occur as a medical assistant and even a nurse, unless you're a nurse practitioner. Okay? So we're merely collecting, testing, and reporting results back to the physician, provider, the PA, or NP. We won't go back to the patient and say, hey, this is what I think it is. That should never, ever occur. All right, so completing the samples, you may be required to collect samples on 3 different days. There'll be times if you're in the ER urgent clinic where the doctor wants to find blood or see if there's blood in the stool. And that will clue into the physician, hey, we need to take 3 days worth of tests just to see if there's upper GI, upper gastrointestinal, or lower GI, lower gastrointestinal bleeding. All right, so the source and the reasons for those all differ and will help them come to a good diagnosis. And obviously, if you know the patient is menstruating at the time, has hemorrhoids, etc., let the physician know. The physician will tell the patient when to come back, or advise you to tell when the patient should come back. Okay. Questions? Good. So that was the fun part, or the fun duties of collecting stool samples and using that Hemacult to test for blood. All right. At times you'll have a patient come in. We'll have to collect specimens for cultures to see what's growing. If we suspect the wound of not healing correctly, is a patient having or suffering from a staph infection, for example? These are the times when the physician, nurse practitioner, PA, provider, whatever, would ask the medical assistant to collect the specimen. All right. So what does it require? Avoid touching the insides of lids, swabs, containers. Anything that you suspect would contaminate the specimen. If you're writing that down, give me a second. I'm just going to minimize that. Good, 1 sec. Yeah, I did. So what are we looking for? Causative agents. We cannot find a causative agent. You guys remember what that's called? Unknown etiologies. ETIOLOGY. Unknown etiology. Hopefully there's no commercial.
After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify him using 2 identifiers.
May I see your wristband? And would you tell me your name and date of birth?
Philip Reynolds, June 25th, 1935.
Good, thank you, Mr. Reynolds.
Before collecting a wound drainage specimen for culture and sensitivity testing, assess the patient for signs and symptoms of infection, such as fever, chills, and excessive thirst. Ask him to rate his pain at the wound site. Apply clean gloves and remove the old dressing. After you've assessed the bandage for drainage, fold it together, soiled side in, and dispose of it in the appropriate receptacle. Now remove your gloves and apply sterile gloves for assessment. Assess the wound by looking for swelling, separation at the edges of the wound, inflammation, and drainage. Cleanse the area around the wound edges with an antiseptic swab. Wipe away any old exudate. Discard the antiseptic swabs. Remove and dispose of your gloves and perform hand hygiene. Then unwrap the sterile culture tube and apply a new set of sterile gloves. To collect a specimen of aerobic bacteria from a wound, remove the swab from the culture tube. Gently insert the tip of the swab into a part of the wound that has fresh drainage. Rotate the swab and return it to the culture tube. To obtain a specimen of anaerobic bacteria, remove the swab from a special anaerobic culture tube. Insert the swab deep into the cavity of the draining wound and gently rotate it. Then withdraw the swab and return it to the culture tube. An alternative method of obtaining a specimen is to insert the tip of a needleless syringe into the wound and aspirate 5 to 10 milliliters of exudate. Then attach a transfer device to the syringe, expel the air, and inject the drainage into an anaerobic culture tube. Regardless of which method you use, be sure to label each specimen tube and verify information in front of the patient. Make a notation on the label if the patient is receiving antibiotics. Place the specimen in a biohazard bag, remove your gloves, and dispose of them appropriately. Perform hand hygiene. Apply clean gloves and clean the patient's wound if required by the healthcare provider's order. Open the dressing supplies and cover the wound with a new sterile dressing. For more information, refer to the video skill, Changing a Dressing. Remove and discard your gloves and dispose of the soiled supplies in the appropriate receptacles, according to your agency's policy. Perform hand hygiene. Help the patient into a comfortable position. Send the specimen to the laboratory immediately. As part of your follow-up care, review the culture and sensitivity test results when they come back from the lab.
Questions? All right, we're all still new, so it's hard to
Identify
really
him.
things to really hit her on. Okay, so we're assessing the patient for potential wound culture, someone that the doctor thinks has a staph infection, for example. It was an open wound, he kept scratching it, or anything. All right, so we're assessing the patient to see if they have a fever. Why? That would clue in and say, hey, there's an actual infection going on. The body's white cells are rushing to the area to fight off that pathogen, the infection, etc. Okay. Temperature. That's why vital signs are important. She did a good thing here. Identified the patient. Could you please state your name, date of birth, and or check the patient's bracelet? All right, should happen every time. Okay, obviously we're gonna lower the side rail. There's a little button down there that allows it to swing downwards or upwards, depending on what kind of bed it is. Okay, so before we even start any of this, hand hygiene, right? Unless you have any visibly soiled hands, in which case you'd have to wash with soap and water. She takes the first set of gloves, removes the bandage, rolls it up to where the dirty side is on the inside. Okay. We talked about inspecting the area and then wrapping it up. Anyone see anything wrong with the way she took off her gloves after doing that doffing exercise? Okay, so she used the correct method here, first of all, using a non-dominant hand. I'm assuming she's right-handed. But she peeled it up from the inside of the glove with the dirty or contaminated outside of the glove. You pinch the outside of the dominant glove to initiate the doffing or removal of that glove itself. Okay. Next, she goes in and puts on sterile gloves. These are wrapped. When we pick these up and we meet in November, we'll learn exactly how to don sterile gloves without contaminating the outside that will come in contact with a patient. All right, with that, we're inspecting the area. She can touch there now because she's already placed antiseptic. It could be iodine, any form of whatever they use there for antiseptic applications on the patient's skin. Okay, she goes to collect the sample. She's removing, actually, first she's removing the exudate, any drainage from the wound, pus, any buildup. Want to get a clean sample. Another set of gloves. So this is where we're collecting a specimen of aerobic or anaerobic bacteria. Anyone know the difference? Okay, aerobic requires the exposure of oxygen to grow in the culture. Anaerobic bacteria can grow without the presence of oxygen. Okay. Note to selves. All right, collecting the specimen can occur one of two ways, either using their form of the collector swab, or as they mentioned, using a sterile syringe tip. If you're grossed out by this looks like moulage, so it looks like it's fake. It's pretty good moulage. All right, we're taking the sample and we're putting it obviously on the inside of the tube, okay? I would say no need to mention it, but I mentioned it anyways. There will also be samples or collectors where you have the collector in a shorter tube. You'll be required to place it on the inside, crack the top, the tip of it, or right in the middle of it, and it'll show you exactly where to crack it, and then place the cap over for specimen processing and transport. All right. Like we mentioned before, aspiration. Aspirating into a syringe is another method of collecting the specimen itself. And as we mentioned before, we do not label the top ever. We label the side, the container itself. All right, only after we conduct the procedure do we document and label the specimen itself. Okay, some clinics will allow you to bring blood tubes that are pre-labeled. But we're going to make sure that we do this by the bedside. That way we're not mixing it up with anyone else's samples. We can go through processing it, but I want to show you another video. Try not to put you all to sleep, but it's easier to just show you visuals and allow you to get caught up on your notes as well. Okay, and post-collection is merely wrapping it back up again. Okay. Questions? Pretty straightforward. But again, the worst question is the one that you do not ask. All right, so don't be shy, don't be embarrassed if you have a question. So that's a collection side, all right? For example, let's talk about specimen processing and transportation, something you're going to always have to do, whether it be urine, blood, wound culture collection, etc. You'll be required to, 1, verify the doctor's orders, 2, verify the right patient, 3, verify the right test, and ensure that is all according to what the doctor needs. We're not thinking that this patient might have strep throat. I'm going to go strep this patient's throat as an MA or a nurse. No, we're going to wait for the doctor to tell us, the provider, the NP, the PA, before we do anything. We don't do anything on assumptions. We wait for the licensed provider to direct us to place the patient's orders. I left something in here. Okay. So what is the role of the medical assistant? Obtain, process, and prepare for transportation. Okay. Give me 1 sec. I have a video somewhere. I don't know what happened to it. Yep, there it is. This one should be talking about urine processing, getting ready for transportation to the lab. So you can either have a lab that's in-house, or you can have a lab like LabCorp come by and pick it up to have the test done. And you'll often see those things outside of doctors' offices. I didn't even hyperlink that thing. When I talk about LabCorp, these are like if the doctor's office does not have an in-house lab tech, they'll have these little boxes outside of the clinic where they put the lab test in there with either ice or however they need it to be transported. They'll come pick it up at a regular hour, or as soon as you call them, they'll test it and get the results back to you. But let's say we're collecting a urine sample here.
Amazon hates this, but there's nothing they can do to stop it. There's a new electric lighter out there, and it's got the firepower of a military.
Sanitize your hands and put on disposable gloves.
Hold on, folks. It looks very blurry, doesn't it? Auto. All right, for some reason I can't expand the video, so I apologize.
Check the label for patient name, date, and time of collection. Any unlabeled or incompletely labeled specimens must be discarded. Place the specimen in the inner pocket of the biohazard transport bag and seal the bag. Remove and discard the gloves and sanitize your hands. Be sure you have the right requisition and it is completely filled out, including diagnosis code. Fold the requisition and place it in the outer pocket of the biohazard transport bag. Place the bag in the proper area to wait for collection. Refrigerate if necessary. If the bag is not properly labeled and the specimen is not properly stored, the specimen should be discarded at the laboratory.
All right, simple stuff, right? And so you actually have to do it. Don't be nervous. Okay, we're gonna always assume that specimens are infectious, that they are dirty. We do not cross-contaminate at any time. We're always washing hands, sanitizing hands with at least 60% alcohol hand sanitizer. Sorry, I'm missing all these chats. I apologize. Jaden, you're good. Okay. Maybe getting contacted separately by Ms. Friedman. So please pay attention to that. We're becoming a little bit more strict about cameras, folks, okay? Unless you have, I should say, any serious injuries, okay, or sicknesses, extenuating circumstances. All right, so what are the requirements for transportation, diagnosis, storage, disposal, etc.? All right, proper preservation storage needs to be identified when handling specimens. So if you collect urine and it's not going to be picked up for a day, it needs to be refrigerated. That clinic that you're working at, shadowing or even performing clinical rotations will have their own rules posted, and they will educate you as to how to collect and store each specimen. All right, whether it be urine, blood, etc. They will often use dry ice packs that they keep at the clinic. And what they'll do is oftentimes they'll even reuse some of the packs as long as the samples are double bagged and kept away from the dry ice itself. All right, we need to take precautions to avoid contamination. All right, proper processing, handling, and transport are necessary for validity and accuracy. So what are some patient identifiers we need to know that need to go on the label? Everything tacked right there, name, assigned ID. All right, it could be the last four of the patient's social or even the patient's account number at the clinic. A specific patient ID that's assigned to the patient themselves. That all varies on the clinic. And obviously date of birth, phone number, and address. All right. These are the primary things I want you to remember here. Patient identifiers for processing, labeling, and transporting collected specimens. It's the very least you should have on there. All right. During the last lesson we talked about the importance of hand washing. Because common specimens in an ambulatory urgent care, outpatient care unit almost always involve blood, urine, and swab samples. They need to, you as a medical assistant will have to process as you saw. All right, get it ready for transport, label it correctly. All right, Follow the office's procedures. When you check into your shadowing, obviously you're going to be standing behind anyone. You're not going to be touching anyone or anything. But when you get into your clinical rotations, they're going to give you specific rules for the office that you need to follow. All right. That ranges from being on your phone, period, all the way to what you need to do when you're getting a sample ready for transport and anywhere in between. All right. So pay attention to what that clinic, office, hospital, etc. has regulations for. And like we saw with the urine sample that the nurse was preparing, the healthcare professional should be placed in a clear biohazard plastic bag with a zip closure or the sticky closures on it, meaning they have the little removable tape, waxed paper, and you fold it over and tape it shut. What you'll also see inside of those bags is a white piece of absorbable material. Do not remove that. Leave it in there with the sample itself. And just like you saw in the video, that biohazard bag had an outside pocket for the lab requisition for the verification of the doctor's orders or the patient ID. Sure, no one else is writing here. Lucia, I got the same color cat. I have a black one too, somewhere around here. Is that the devil cat you're talking about? Wait, who's the one that got killed by their cat almost that other time?
That was Julia.
That was
That
me.
was Julia, sorry.
I'm still giving him the silent treatment. I haven't spoken to him. I don't trust him anymore. He's so mean. And he did that literally like that weekend I had homecoming and I still had like the scratches on the side of my face.
Oh no, how do your photos look?
They looked fine because like I covered it up pretty well and you couldn't tell. But like there was like I had like 3 different like scabs.
Oh my gosh.
And it kept like I don't know. There was like this like clear liquid coming out of it that was not blood.
That's pus or exudate. Remember what that lady was clearing off on the side of the guy's wounds? That's exudate.
Ugh, nasty.
Yeah. Soap and water, always, whenever you get scratched by your cats, okay?
Yeah, that's what I did.
Cat scratch fever.
Isn't
Don't
that just
want
from kittens though that live in like barns and stuff?
Oh no, any cats, because they're romping in their little things.
And my
Whatever
cats
you
are
have set up for
outdoor.
them. No, even cat litter, walking through that can be bad.
Nasty. It's so gross.
We still love them though, right?
Yeah, but my other one's my favorite.
We have a black cat and one that looks like Lucia's there,
Oh.
and they fight all the time.
I have like mine's like a long-haired gray cat. He's like part Russian blue, and then my other one's just like a long-haired tabby.
Ah, nice.
Yeah.
Thinkers, all of them. All right. Okay, what's a chain of custody? Anything that requires handling where we are sure that nothing will be cross-contaminated, Nothing will be compromised by anyone trying to switch out a sample, i.e., for example, urine specimens required for drug and alcohol tests. All right. Pre-employment urine tests are considered legal specimens. And these are cases where the patient has to sign a consent form. And that is considered a chain of custody. So from every point of or personnel, healthcare professional it touches is going to be signed over every time it's moved from one person to the other. Or if it's moved from one person to a specific storage location, it has to be documented. And it's like collection, Mr. Domingo, medical assistant, for Hannah Hipst, RN, for example, collected this date, this time. Next line will be this date, this time, goes into the fridge. If you're ready to bring it from the fridge to the transport or give it to LabCorp, for example, it'll be Avery or Lacey Bittner, RNs, taking it from the fridge at this time, delivering to this location. That is the chain of custody, literally a chain that says where it was every hour of the day for specific time periods. Mackenzie, you're good for soccer. Thank you for asking.
Thank you.
See ya. Shimon, thanks for the notification about Amanda. No problem. All right, as you can see there, permanent seals on the bags until it's open for analysis by the lab techs is required. Filling out these sheets here, they'll be in like 3 or 4 part sheets with carbon copies on the bottom, filling it out by hand, signed by yourself and the patient. Patient gets one copy, the medical officer gets one, the lab gets another, etc. And one stays with obviously the office. Questions? Okay. That is an example of a chain of custody. They don't always look like that. Like I said, they could come in the form of carbon copies, multi-layered copies. All right. But for example, like we mentioned, received from, received by, date, time. If it moves from place to place, person to person, it needs to be documented every single time. So that indicates the source of the specimen, patient signature on the consent form states officially that they're the same person that provided that sample. So in the court of law, they can't say, hey, I did not provide that sample. That can be challenged because both the patient and yourself have signed that chain of custody. And that's why this is kind of flawed here, because it needs an origin where both parties sign, yourself and the donor. All right, what this doesn't show also is the fact that you need to document. There will be a section on the chain of custody. It's like 8.5 by 11 form, for example, and it has everything from the patient demographics to what they've been taking for prescription and non-prescription drugs, what will give them a false positive, for example, okay? Any substances that they consume, like over-the-counter medications, any kind of supplements like vitamins, have to be listed on there. Anything taken within the last 30 days. And as always, we dump soil body specimens into red biohazardous waste bags. And use sharps for anything that could stick you, needles, broken glass, ampules, vials, etc. All right, questions? Kayla, you got a blanket on at school? But yeah, no, it's it's gotta be cold then. This could be funny sometimes. All right, questions, comments, concerns? Okay, again, each clinic will have its own way of doing things, but they're going to at least follow the bare minimum of these OSHA standards, period. So OSHA will set the baseline standards. The clinic can be as strict or relaxed as possible, but they cannot be any more relaxed than what the OSHA standards indicate. Excuse me. All right. What do we do with lab results once they come back from the lab? All right. Should be familiar with expected values, meaning ranges. So if you're looking for red blood cell ranges, hematocrit ranges, HCG ranges, we need to be familiar with it or know where to find those ranges. Luckily, when we have results come out, and you may have seen this if you have blood tests, if you had, like, say, a complete blood count, it has red blood cells, erythrocytes, leukocytes, etc., platelets. It'll give you the range in which you fall in and the normal ranges which it should be between to the right. All right. So it's almost all automated now. So even if the lab testing is not done in the office, a general knowledge of normal values is commonly performed, and knowledge of it is important. This allows us to alert the provider for any abnormalities that we've seen or witnessed. We do not tell the patient directly. Again, we don't tell the patient what we think it is, whether it be you be a nurse, MA, X-ray tech, lab tech. You let the provider talk to the patient about the results. Cannot stress that enough. If I gotta go back, let me know. All right. EMRs versus EHRs. We should remember the difference between the two. All right. So lab test communication is expedited through the portals that we discussed in the first chapter. This eliminates need for hard copies, etc. Okay, so that's the benefit of EMRs, is that we can share patient results between healthcare facilities if the patient authorizes it first. Okay, that's where the MPP's notice of practices comes through in HIPAA. We need informed consent from the patient. As it states here, results should be accessible to the patients in their EHR if possible. The EHR, again, differs from the EMR. EMR can be shared between hospitals. EHR is the clinic-centric record that we discussed. It could be hard copy or electronic. So what happens once you get the results? The doctor can tell you, contact such and such patient, let them know that this value was higher than we expected. This is the test we did, we informed the patient about. We need them to come back in for a retest or to talk to them about what we think the diagnosis may be. We do not conduct these calls at the front desk around the patient waiting room. We go to a private room to maintain HIPAA compliance. Again, I'll reemphasize, we don't discuss patient issues, diagnoses, lab values, anything in front of anyone else. It doesn't matter if you have a healthcare worker from another department there. Don't assume that it's fine. Go to a private room or private area where no one else can hear you. It is a need-to-know basis. Questions? All right, let's pause there. What I want to do is bring on Ms. Friedman, our grades, and I'll have, if you don't mind, Ms. Friedman, talk about how much more stringent the grading process will be going forward after the midterms.
Absolutely. So it looks like we had a pretty big increase in some of you not completing the exit tickets, whether or not it was because you didn't have access or whatever the reason is going forward. We have a clean slate kind of deal here. All of the exit tickets are not going to count towards your grade, on the understanding that going forward from the midterm, every single one will be, and all of those zeros will be reflected thus forward. If you are having issues accessing these exit tickets, please let me know. I will put my personal phone number and direct line and email in the chat so that you can inform me as soon as possible. I am also now in the GroupMe with everyone. So any sort of technical issues come my way, please feel free to reach out, because I want you guys to be able to get those points. They're easy to get. And all of the questions here forth until the midterm will be questions that you'll see on the midterm. So that should help get you familiar with what the exam will look like. Of course, after the midterm, those questions will change a bit, but that's what it will be like going forward.
Thank you. Questions?
I just have a question. So I've completed the both question of the days and then 6 and 7 earlier today, and it says they're still missing. So I was wondering if you have to go in and auto do that, or if it like updates by itself. Because if you have to do it, then like no big deal, but I didn't know if maybe I like did something wrong.
Yeah, absolutely. If you did the question of the day today, just give me a couple of more hours to get those in. I'm also I'll go through the rest of the questions of the day if there's anything still missing. If it's actually there, yes, I will have to go in and change it myself. So.
Okay, and the 6 and 7 too, right? You do that too?
Yeah,
Or
we'd have
not like you, but Okay, I was just making sure it didn't like update by itself. But
Yeah, it
thank
still
you.
shows as missing for some reason. Submission. And no files attached. Yeah.
All
Okay.
right.
We'll work that out. Thank you for bringing that
Okay.
up. Anything else?
Do we not have to post our class notes today? Because I didn't see like anywhere to turn it in.
We're making changes. I'll let Ms. Friedman address that as well.
Okay.
Yeah, so similar to what I was mentioning about the exit tickets, the class notes in this case are changing a little bit too. They should just be questions, multiple choice, that will get you familiar with the exam content going forward. So any sort of class notes prior to today, I guess in this case, don't worry about. But going forward, it will be questions that will help you get familiar with the exam and will be multiple choice, not fill in. So it won't be like taking a picture of what you are currently writing. It's going to be very similar to the exit ticket format, of course.
Thank you. Good question. Who else? All right. Obviously, Ms. Friedman is the brains behind this operation, but behind this team. So if you have anything technical to ask, you need to ask her, not this guy. Okay. Joking. You can always ask us both. What else are we missing, Miss Friedman? Questions of the day. Okay, let's address the homework chapters, okay? So between now and next Wednesday, we're going to be going from obviously 7, 6, 5, 4, 3, 2, 1, all the way to Wednesday in preparation for Friday's midterm. For those of you that are starting fall break on Monday, we need to figure out what's going on. When do you plan on getting back for those that are leaving Monday?
I'll be back the following Monday, but I know that KLR goes on fall break that week.
Correct.
In my email from school, we were told to still attend our meetings, even though we are on fall break.
Okay, so what I'm going to do is like throughout next week, I'm still going to be having classes. We're still going to be having classes or conducting. You're still going to have assignments due as well. Yeah, I don't know why they're not synced, but oh well, I'm sorry.
No, it's
To
okay.
make you a
Don't be
better
sorry.
medical assistant. Yeah, Ms. Friedman, we'll have to talk to them about that, especially the ones leaving Monday.
I'll make a note of it. Absolutely.
Okay, questions, concerns regarding upcoming assignments, missing assignments. Again, you will not have a project this week or next week. I want you to focus on that study guide, on getting the homework done, reviewing each of those chapters. And I am okay with releasing those chapter homework assignments a little bit early if you're comfortable with it, but I paste it every couple of days to make it easier on you so you're not feeling overwhelmed or bombarded, okay? All right. I have nothing else. Ms. Friedman, are you good? Okay.
I got it all. Yep.
All right.
I'll make an
All right,
announcement
folks.
on Google Classroom of my information just because, yeah, we ran out of time here.
You're the best. Thank you much. All right. Let's get our assignments in. Let's study, 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 and have a great day. Thank you.
Thank you.
Mr. Domingo.
Have a good day.
Yes.
For the classwork, it says I need access.
Oh, no. Let me open that up real quick. Second. Settings. Responses. And it was on again. Okay. Yeah, you should be good. Just refresh your screen, okay?
Mr. Domingo, I just had a quick
Yes.
question. I sent you an email yesterday. You had an assignment due at 3:30, which is totally fine, but I just had an appointment yesterday and I didn't get home until it was past due, so I didn't get the chance to do it. Normally, like the assignments are due like 11:59, so it's never a problem, and so I never submit
Yeah.
the form. But would you like me to submit a form for that then?
Just submit the assignment and I'll give you full credit for it. That's my fault.
Okay, I already submitted it and it's been graded, but I just didn't know if I needed to like
Okay.
have my mom email you or not.
No, you're good. You're good.
Okay, thank you so much.
Thank you. Have a good one.
You too.
Zane, are you good? Lucia, Aubrey?
I did get all of those assignments turned in, including chapter 6, so I have everything done now that my service is finally back.
You're the best. Thank you.
Thank you.
Yeah, they had power outage for quite a while, Ms. Friedman.
It
Gosh.
was awful. I was behind in my regular schooling, behind in KLR. It was pretty bad.
Yeah, that's super
Glad
stressful.
to hear you're back.
Plus, working on top of that, it was chaotic.
You're lucky it was in the middle of the summer when it was still humid, right?
Oh, yeah.
Good deal.
But thank you.
Glad to hear it's better. Have a good one.
You too.
Yes, Nurse Shimon and Nurse Amanda, what's up? I know you have a question for me. No? Tequila, you good?
Yes, sir.
All right. Have a good one.
Mr. Domingo,
Yes, ma'am.
can you tell me how many questions I have on midterm?
100.
Oh, okay, thank you.
Okay, no problem. Aren't you excited about that?
Yeah.
You know what's worse is when you take that NCLEX exam, it's
Mhm.
going to be a lot more than that. And sometimes if you do really well, it'll cut off at 75. If you do, okay, so you don't know. It'll cut off at 75 if you're doing really well, or cut off at 75 if you do very poorly. You get all 75 wrong. So you'd be thinking in your mind, oh my God, did I fail or pass? So it's really confusing. But just be ready for that. You and Amanda will be fine.
Yeah. Thank you.
No problem.
Have a good
See ya.
day.
You
Have a
too.
good day.
You too.
Okay. I'm sorry about coming in like in the middle of all that. The appointment I had with Shauna kind of got absolutely postponed. I
Don't
have to go to another.
apologize.
Appreciate it. I have to go to another meeting really quickly, but I wanted to just ask you really quick. Did Maribel Guzman give you any excuse or reason why she wasn't here today?
Nope.
Okay. I'll bring that up with
After
Katie.
meeting with her already, right? Is that crazy?
I know, that's why I'm a little frustrated. Okay. Sounds good.
Yeah. All right. You're the best. Thank you.
See you later. Alrighty.
Good kids, huh?
Yeah, they're awesome.
Yeah, they're great. Big difference from POH. My God.
I see that. All right. I'll see you later.
I'll work on the question of the day tomorrow, or did you do that already?
I have not done that yet.
Okay. I can do that if you want.
Yeah, if you
as
don't mind,
well
that'd be
as
great.
let me take care of that and the exit ticket, okay?
Okay.
And
I did
going
attendance
forward, you and
for
I will
today.
work on it together to make sure that we just have mutual understanding of what they're getting.
Sounds good. Sounds good. Especially because there's a new system with it, with questions that'll be on the midterm kind of deal. So I'll
yes,
work on this with you from now going forward. And I
Sounds
also I
great.
took attendance for class today, so it's all done there.
Okay.
All right,
Go.
posted those.
You're the best.
Alrighty. See you
See
later.
ya.